Hello, everyone, and welcome. So happy to have you here with me today. And we have a really fantastic topic for you today. I'm so looking forward to learning more myself, and that is around dry eye. And dry eye, as you're probably aware, is one of those conditions that so many people struggle with. I can think of several just off the top of my head. Yet, even with the drops, procedures, and the standard approach to treatment, for the most part, I'd say people are not getting the relief that they need. So, what are we missing? Well, today we are going to take a look at this condition from a functional whole body approach that looks at the deeper drivers behind dry eye and how lifestyle, nutrition, and symptoms based care can actually change outcomes. I am so excited to be joined by Dr. Neda Gioia, who's bridging optometry with functional medicine, which is so great. I love that combo and in a really powerful way. And she's even presenting this work at IFM upcoming this year. So, if you're ready to rethink how we approach dry eye, this is going to open your eyes in a whole new way. So, welcome, Dr. Neda. So happy to have you here with me today.
Oh my gosh. Thank you so much, Leslie, for not only having me, but actually giving a voice to this topic that just needs more and more attention. I really am just excited to present this at IFM's AIC this year. And for the feature today, I think this is wonderful for your audience.
I do too. It is such a common problem. Can you give us any statistics behind how common it is? I'm sure
Well,
it's underdiagnosed, right?
Well, that's where it gets a little bit confusing. Most people
Okay.
don't even understand that dry eye is a disease. A lot of people think of it as just like it's just dry eye, but
Yeah.
it's actually classified as dry eye disease.
Okay.
And obviously, globally, the statistics are slightly different, but in the US alone, there's estimates of about 8% based on meta-analyses of the population that suffer from dry eye, and that's the percentage that we know. Globally, it's been reported 5 to 50%. So this is a high number of the population. Socioeconomically, is it's also a problem, especially with our work. You know, and I always say when your eyes don't feel good, you
Yeah,
tend to not feel good just systemically as well. It's a very high level sense in our body.
absolutely. So you have a very unique approach, and essentially you're bridging optometry and functional medicine, which is honestly such a unique combination. Can you give us a little background on what led you to bring this particular perspective?
Absolutely. I was classically trained as an optometrist 20 years ago. It doesn't feel that long, but 20 years ago. And when I started, I was kind of doing the primary optometry approach, standard of care. And then mid-career, I had a little bit of a health scare, not a little, kind of a lot actually. And
Okay.
I decided to go back to school for basically learning about holistic health, nutrition, etc. And when I applied the functional medicine approach to my own health, which was basically life-changing, I said, there's a lot of systemic conditions that are linked to our eyes, and why are we not talking about those things and what where are all these missing links? So it's been a thirst that has not been quenched in my mission to expand how we really see integrative health and integrative vision, I call it, where we really implement these other approaches to a condition, which is, not just in eye care, of course, but in eye care, there is foundational evidence and we keep getting more and more of it. It's just time to now implement it. And that's what I'm really trying to connect at this point in time.
I love that. So how did your work, essentially, I guess we'll call it the intersection of functional medicine and eye care lead to the development of this particular poster
Mhm.
upcoming at IFM, which is so exciting. Congratulations.
Thank you. This is my second year presenting, and I had such an
Nice.
amazing experience last year. When the opportunity came about again, I said, you know what, this is like something I'm really passionate about. So let's see how IFM respects my approach to dry eye disease, and it's been wonderful ever since I made that decision. So basically, the framework is something that I started probably roughly about 7, 8 years ago, and it had nothing to do with dry eye. It had to do with clinical care. So when I opened up my practice and I decided to go down this road of having a different view of how to treat eye conditions as a whole, I had created like a clinical model where I was, treating my patients with good standard of care approach, comprehensive eye exams, but I also allowed extra time for the patients that were more proactive to pick my brain, to discuss nutrition, to discuss their long list of supplements, to discuss lifestyle changes that might enhance or improve that eye condition that we had discussed. So I
Mhm.
created this system called, and it was not a fancy title, it was called the Eye Exam Plus. So it was this little, decision I made to allow my patients to have this extra time with me and these extra points of contact to help with their lifestyle changes. Now, at that point, I already had been educated in some nutrition, functional medicine, etc. So it was very like organic for me to just add that. It was just like an autopilot feeling for my clinic. Now, lo and behold, I started it thinking, okay, a few people are going to sign up here and there. And the response was pretty big from the get-go, to the point that I actually had to increase my fees to slow it down a bit. And, we're at a different point now where I'm fully concierge, but at the point I had a hybrid model with insurance. And at
Okay.
some point I said, like this is like testing the audience. The audience wants this type of mindset. They want to ask these types of questions. They want their clinician to kind of filter the noise that they're getting on their own research or perhaps not getting at all. So that was kind of the tone and the foundation that made me think of this next step and more of a proposal for doctors, eye doctors, to think about how to treat their patients. So that was the foundation. So now, lo and behold, something called the TFOS organization, which, if you don't know about TFOS, which even optometrists don't even know about TFOS, it's called the Tear Film and Ocular Surface Society, and it's
Okay.
a world leader in eye health education, nonprofit. And they basically publish this high level evidence-based education about dry eye. And it comes out, I mean, I believe the first one was around 2007, and then they had an enhanced, we call it the dues report, which is basically a workshop report with pages and such dense information about what dry eye disease is, what are the drivers of dry eye disease, what are some of the best procedures, etc. So this report started roughly in 2007, and there was a more recent one in 2025. And I've become very appreciative of that society because in 2023, they actually published something called a lifestyle report, which caught my eye. Obviously, that is like my passion. And I was like, wow, a society is looking at lifestyle in an ocular condition. Now, mind you, this is not a nutrition based organization. It's based on eye care providers and professionals, PhDs, medical doctors globally, who get together and just filter through all the evidence and publications about dry eye disease. So in 2023, when I saw this lifestyle report, I was very lucky to be connected with some of the authors and the executive director. And I was just floored with how good the content was. And then fast forward in 2025, the DEWS 3 report was released, which is a wealth of information from this TFOS organization. And another thing caught my eye in terms of treatment care. Repeatedly, it kept saying modifiable lifestyle factors to be addressed in all types of dry eye disease. And that's because dry eye disease, and I love to read the actual definition
Okay.
based on the TFOS, and it's a quote. Dry eye is a multifactorial disease of the ocular surface and tear film that results in symptoms of discomfort, visual disturbance, and often visual impairment accompanied by ocular surface homeostatic dysregulation, inflammation, and neurosensory changes. So that is the official definition of dry eye disease. So when we say dry eye, we're talking about something that's much more complex. And this is where the messaging is not going out into the public, right? So we're getting this wealth of information. We have all of this foundational evidence, peer-reviewed evidence that lifestyle mitigation in certain cases, in certain types of dry eye, etc., can help improve outcome. So I see this and I'm like floored and I'm just like so excited. And there's phenomenal questionnaires and ways to diagnose the dry eye. And of course, we have diagnostic tests and all of these fancy tools. Um, and then I said, okay, well, we know the lifestyle part, and obviously we'll break it down a bit in a few moments, but is important. So what are the clinicians doing? Where do we actually execute that?
Yeah.
And that's where my CNS/ functional medicine education comes in. And I said to myself, we don't have like a starter for these clinicians to even go in that direction. Of course, in a clinical setting, you could kind of like mention, hey, your diet, eat healthier, that helps your dry eye, for example, right? But we know, like as in the nutrition world, it doesn't do anything, right? We need to get deeper. We need to actually get into behavior modifications, et cetera, et cetera. So I thought, let's now bridge that whole like lifestyle is important for dry eye mitigation to an actual like bridge of implementation for a clinician. And this is not poised for a clinician that is nutritionally, educated, full functional medicine, because that really narrows down our numbers, right? I propose this for a general clinic that wants to be a little proactive, and it actually uses the tools of our whole healthcare system to get these patients to where they're supposed to be, to help actually hear their complaints in a separate type of appointment setting, just like my eye exam plus idea, and
Yeah.
perhaps implement these evidence-based approaches like that we have all this data on in their clinical setting and start this domino effect of getting patients better systemically with these modifiable lifestyle choices. So that's a long explanation of why this ended up, happening. But it's more of my experience, my, viewpoint on some really, really sound evidence-based approaches that was published by the TFOS organization, and ultimately my ultimate underlying goal to really connect classical and allopathic care with our nutrition, our functional medicine approaches, because I really think that's what will work best in our future, taking care of our patients, and that's the final goal, right? So that's my foundational reasoning why I ended up creating this framework.
It almost seems like the diagnosis name, dry eye, it almost feels like what do we want to call it? Like not deep enough. You know,
Yeah,
it's like, oh, my eye is itchy, or you know what I mean? It
correct.
almost feels just so surface
Correct.
level.
Yeah,
And
and you're right. You're right.
it doesn't really just the diagnosis name doesn't really speak to how, I mean, honestly, how intense this is.
Absolutely. And as, as professionals, we're trying our best to really translate that level of diagnosis and
Mhm.
care and prevention and early intervention with dry eye disease,
Yes.
just like we would translate that conversation to other ocular diseases. Yes, it may not be equal in terms of vision loss or things of that
Sure.
nature, but there are other components that you don't have to have full-on vision loss to care, right? I've
For it to
had
feel bad too, right?
for yep, I've had people who are miserable because of their dry eye. And not to mention it can trigger other things, and it's
Oh,
it's it's
interesting.
also sometimes an early indicator of systemic disease like thyroid
Oh,
dysfunction, and now the fun conversation I keep having about perimenopause and menopause with the roller coaster ride of hormones. So it is interconnected to so many systemic health issues. And as I said, the quality of life factor is so
right.
intense, but yes, there's a messaging issue right now. And calling it dry eye, fine, but we should actually start thinking of it as dry eye disease.
Yeah, that, I mean, that actually encapsulates it much better based on what you're sharing today. So
Absolutely.
interesting. So, can you tell me a little bit about the interdisciplinary collaboration piece to treating dry eye? You yourself have the CNS designation, which is amazing.
hmm
In addition to you being um, an IFM practitioner, which, again, is pretty astounding as well to have all of that training and education behind you, in addition to being an optometrist, a doctor of optometry. So what is your approach on the collaboration necessary?
hmm
I would assume, especially with other nutritionists. So,
Oh, yeah.
yeah, tell me a little bit about your thoughts there.
My thoughts are very, very strong. So I do think most doctors need some nutrition, just verbiage. They need to be able to actually, they don't have to understand everything about it, that there has to be a little bit of literacy.
Mhm.
Why? Because we all know when we're, especially in the nutrition, type of specialty, that having that literacy to a degree helps with patient outcomes. So if you validate nutritional intervention as a clinician, as a doctor, you really start stepping the patient into the right direction. And you're actually validating the next steps if they want to connect with something a little bit more expansive with a RD or a CNS or specific types of health coaches, et cetera. So the disciplinary part of it is 1000% includes nutritionists. And I am a big advocate for clinicians to find and connect with their local nutrition centers, people, to actually have some sort of relationship, to actually be able to bi-directionally help that patient. And yes, of course, I have my CNS and all of the things in between. And of course, I can help my patients kind of direct them directly to what I would like them to adhere to. Let's just say the standard Mediterranean diet, which sounds so blasé and so easy peasy. It's not. If we could even just get our patients to do that, it's a huge, huge uphill battle, especially if you don't have the clinical background in nutrition or in motivational behavioral, interviewing, etc. So yes, the framework does have a few subsets of referral patterns. And nutrition is a huge highlight because things like the Tear Film and Ocular Surface Society substantiates and, with evidence-based, studies show that we have better outcomes when we adhere to certain polyphenols in our diet, vitamin D in our diet, omegas in our diet, various anti-inflammatory foods in our diet that help reduce that inflammatory cascade that happens in the ocular surface. So the question is, not that we believe in the nutritional, intervention. I think if you ask most clinicians, they'll say, yeah, absolutely. This is something that has, great evidence. But then you're like, what are you doing about it? If we know it works and helps, why are we not doing anything? And again, going back to we're going past the okay, just stick to a Mediterranean diet as a one sentence finish, send the patient off. It's, hey, listen, I see that you're a little motivated. You understand what I'm saying. We know like you have some dietary improvements to be made. Let me connect you with some nutritionists locally. Let me connect you to dot dot dot. And that is one referral, interprofessional referral that I highly recommend in my lifestyle framework.
So good. So speaking of which, let's go a little deeper if that's okay with you in terms of those lifestyle factors that really do play a role
Mhm.
in contributing to dry eye. And I'm kind of throwing a lot in this question, but I'm also a little bit curious about how effective are the drops? I assume that's like kind of the standard treatment,
Yeah.
right? Is that true? Um, so tell me a little bit about the efficacy with,
Mhm.
just the drops versus maybe digging into some of these lifestyle factors as well, such as sleep, stress, and nutrition.
Great question. And the drops, I would say, is a very blanket word. So we have, let's to make it very simple, two types
Okay.
of drops. We have pharmaceutical drops, and we have non-pharmaceutical
Okay.
over-the-counter drops. The pharmaceutical drops, the purpose is to create or to, block some sort of inflammatory process, typically to stimulate basal level tear, which is our like baseline tearing, not reflex tearing, which is the bad kind of tearing that's not natural. So pharmaceutical agents have been out for a long time. And there's different classes. So I don't want to say it's like one size fits all. And they do
Sure.
have percentage of, improvement. Obviously, the percentage ranges. And right now, the biggest application of those medications is to understand why your patient has dry eye and the maybe some of the subtypes of dry eye, and will that medication even have a high probability of working? So assuming that's that, right? What percentage actually do great? I don't know. And the reason is, um, it's individualized. So some
Mm.
patients do great, some patients don't do great. And it's also chronic. So it's not like you take the drops, you stop the drops, and you're good. So it's continuous usage. So what do we do? What happens with any medication that has to be used constantly? The adherence goes down, right?
Mm. Hmm.
So that's one class. Then we have
Yeah.
over-the-counter eye drops, which I mean, I use them sometimes. They are phenomenal. The technology that has come out with over-the-counter eye drops, and I'm not talking Visine. I'm putting a big X on Visine.
Okay.
That is the worst of all. Please, if you take one message home today, it's don't use
Don't use
Visine.
Visine.
No, it's not a good one. So they have great advertising, but so we have some phenomenal topical eye drops that are
Okay.
non-pharmaceutical that help balance the oil percentage on the tear
Mm.
film, that really help lubricate the ocular surface while we're sleeping. Some people have issues while they're sleeping. Um, Travel, let's just say in your bad environment, allergies. So, and I love it because it's direct to the place that it's supposed to go to. So you're putting it right on
Mhm.
the surface of the eye. Again, going back to, do you have to use it consistently? It's a drop. You have to put it on your eye. It's a physical entity. There's wet. You have to bring it somewhere. So there's those components of usage. Lifestyle addition to these things. The goal is not to say just do lifestyle so you never need medication. Just do medication so you never need lifestyle. Or these other newer procedures that are phenomenal, laser procedures we have now, IPL, and phenomenal procedure that helps stimulate the oil glands on on our eyelids. It is not a this or that. It is your eye needs remember, going back to the disease definition, it's multifactorial. So typically there's multiple things that have to be looked at. And yes, the topical agent may help XYZ, but if we don't, so it's going back to, if we're coating the eye while you're sleeping because you have some issues while you're sleeping, wait, why are we not talking about the sleeping in the first place? So what's going on with the
Right.
sleeping? Wait. Okay, well, okay, you're sleeping bad. Let's put some ointment on your eye or a gel. Great. That is making you more comfortable. It's soothing. But has anyone talked to you about the sleep problem? Because that's a problem. So, so again, knowing that sleep apnea, this is another node of
Mhm.
my questionnaire. Sleep apnea. Even sleep apparatus, the machines, all of those things can actually exacerbate dry eye or even trigger dry eye disease. So if you have a patient that has floppy eyelids, you see lid gap issues, they're drying out in certain patterns, you need to send them for a sleep study.
Hmm.
They may have sleep apnea, and you may have just saved their life just by that one referral. Of course, you're
Wow.
not doing a sleep analysis, you're not going full
Of
force,
course.
but you are recognizing that this is a lifestyle issue. And now, after asking a certain amount of questions about that node, you can see in black and white that, hey, this might be something that needs expanded education, expanded referral for. So, I don't like to think of dry eye intervention, any of it, as this or that. I always call it complementary. Um, Maybe with your lifestyle approaches, you'll need your eye drops less. It doesn't, but you may get it on a plane and have a trigger, so maybe you'll need it more in that sense. So I wouldn't say it makes up one type of intervention. It's usually what I would say they complement. And that's really how we want to view all of integrative type of healthcare, right? It's the complement system. So, but great question, because yes,
Fascinating.
I'm not saying
Right.
don't take your treatments as
Right. Right.
directed.
Yeah. It's not like you said, it's not one or the other. It's really a compilation of
Mhm.
interventions. I had no idea about the connection with sleep apnea. That is absolutely fascinating.
Yes.
Wow.
Yeah, that is actually one of my expansion questionnaire nodes. I have about
Yeah.
six classifications, and one specific classification is on sleep and recovery.
Yeah.
Questions about sleep and recovery, specific to basically, teasing out some information from the patient, which you're not going to really get on a general intake. The basis of this is to talk a little more. We know how fast clinics are. We know how that framework works. But if we're able to add some sort of second appointment that is based on lifestyle questioning, etc., for the doctor or the doctor's technician that might be trained in this too. It doesn't even have to be the physician, as long as the physician is really kind of supporting it. But yeah, sleep and recovery is one of my major nodes in the
Okay.
framework. Absolutely.
And do you find that physicians are, once they learn that there actually is a connection, how willing are they to begin to implement, in
That was
terms of,
so.
with their own patients, getting them the referrals that they need. I'm
Mhm.
curious about, just the acceptance.
The acceptance depends. So we have obviously the clinician themselves who either believe or don't believe. Like we're not going to talk
Okay.
about the people that don't believe in
Right.
any lifestyle modification. But the people who do believe, they have, it's twofold. They're either allowed to do it in their clinical settings, because some
Okay.
clinical settings don't allow things to
Oh,
happen.
interesting. Okay.
You may not have that autonomy yet, or you might be early in your career and you kind of don't really want to change things up.
Sure.
And then we have clinicians that do have autonomy, and a lot of times, and I get this question a lot because I try my best to mentor as many optometrists who want to go into this direction as a whole, not specifically for dry eye, but
Okay.
um, the biggest thing is like, where do I start?
Okay.
Yeah, I want to refer them, but it's like I have to say it in 5 seconds. How do I fit it all in? That's
Right.
always a big issue. So it's like I believe in it, I want to do it, but like, how do you do this? How do you start? Um, and that's the majority of the questions, actually. It's like, how do I
Okay.
start? And that's kind of why I wanted to start this whole approach or this proposal sort of as like, let's start simple. Let's pluck some highly relevant questions in various nodes of lifestyle, put it all together, create a pattern recognition for you to check box things that need to be further treated or referred to, and let's start there. And during that assessment, we can start discussing, is this something that's outside of insurance? Is this a hybrid model, as I had kind of alluded to with my Eye Exam Plus? How do we actually get this going? And it really depends on the clinic
Okay.
itself. But I think it's doable.
Yeah.
Um, Especially if you micro start. I always say like you don't have to change your whole clinical setting. Like this is a micro change, just like we want micro changes in our when we coach patients to change their diet, etc. Like the small wins. Try this on a few patients. Get
Okay.
some small framework started. But that's usually the most common question is like, where do I begin?
Okay. That's fascinating. So let's talk a little bit about the time we're all spending on our screens in this day and age. I'm so curious about, what is the impact all the
Mhm.
screen time that most of us have every single day, and what role does that play in the development of dry eye disease? And I don't know, does it impact other eye the potential for other eye disease?
So this type of question really catapulted during the COVID shutdown. This was like a very hot topic that was
Mhm.
just has not gone away, obviously, because our world has turned from, somewhat
It
electronic and
has.
virtual to like very much. And now we are upwards of 10, 12 hours, full work days and plus on digital devices, and we don't need to go into all of the various digital devices, and age is not a factor anymore, right? So it's of
Yeah.
all ages, obviously, of course, the youngins, we want to try our best to reduce that. So there's different patterns. So behavioral change happens when you use electronics, period. One big behavioral change is something called your blink rate. So I actually saw this funny AI model about blinking. It was kind of cool
It makes me
about,
want to blink.
yes, and that's
Just when
that
you
is
say that, I'm like, ah.
yeah, and that's a underspoken type of shift in your behavior when you use electronics. Electronics, you're using it not in a passive way. Typically, you're kind of paying attention to something, you're taking in information, and that inherently tells your brain that there's an active intake. And because of that, we need to blink less because we need more information. So let's pay attention, let's blink less because that's what we need. That blinking pumping mechanism actually has a biological purpose. It's not just for fun. We're not just blinking because we're supposed to blink. It's because it's supposed to resurface the oils on our cornea. It's actually activating certain glands in our eyelids, and there's this reduction of that activation when we blink less. So inherently, they're seeing now in kids, which we've never seen before as much, dry eye disease in kids, right?
That's terrible.
So so it's like, wait, what happened there? And, it's obviously that's one major problem with electronics is just your behavioral change of your blink rate in and of itself increases dry eyes and can actually impact your oil glands. And
Mm,
if your oil glands don't work properly, people don't realize there's these little tiny oil glands in the water lines of our eyes. And if they don't work for a certain amount of time and get impacted and they're not pumping naturally, they just die off.
mm,
And that's not good. So
no.
now fast forward 20 years where you have other natural aging processes that might dry you out. And now you have a lower level, lower percentage of oil glands to even get, starting into those other life changes. So that's one huge factor. Light in and of itself, that is the big, big like debate. There's no evidence that shows that certain light colors, and we'll talk about blue light,
Okay.
of course,
Oh,
um,
interesting. I
actually
can't
fully
wait.
damage. Yeah, so
Okay.
I would say that also. But yeah, tear film disruption is classic in excessive electronic use. There's something called the 20-20-20 rule that we 20 minutes, 20 seconds of eye break from the electronic, whatever gadget, and blinking during that 20 seconds and looking 20 feet away. That is kind of like the most basic framework.
Okay.
Um, but yes, and there's other things. Like I just did a digital detox for 2 weeks where it was like, and my brain was clearer too. So there's absolutely triggers with digital device usage and changes to the ocular surface. And that's part of actually, that's my first node in my questionnaire.
Okay. How much
Um,
screen time?
yep, digital
Mhm.
device kind of patterns and your environment, of course. Like, are you in a certain type of pollution centric environment? That also air quality affects the tear film too. But yeah, that is a major node.
Okay. And then can you comment more on I think it's the blue light, anti-blue light
Hmm.
glasses? Am I getting that
Oh,
right?
yes, yes.
Tell
Blue
me,
light goes.
yeah, tell
Uh,
me, do you can you comment on the efficacy of those things and, just why people do it? It's my understanding that it helps improve sleep, but I don't know if that's really true.
so quickly, blue light glasses became hot during again COVID. A lot of advertising, a lot of
Okay.
direct to consumers. So the first thing I always start with when I explain blue light is that there is no regulation on the actual eyeglass. There is no checks and balances.
Okay.
Unlike other things we use in eyeglasses, like ultraviolet protection, there are actual seals of approval that you have to
Okay.
get. Blue light has nothing. So you can get blue light without having blue light glasses. So it can block nothing and still you could
Oh my
label as blue light.
gosh.
So that's the first thing. So you have to
Okay.
read labels. You have to look into the company that you buy it from. Secondary, blue light is not just one wavelength. Okay, it's a whole span a
Mhm.
chunk of wavelengths that do peak at a certain amount that are seen to have the most ocular effects. When I say ocular effects, it can go through the eye a little bit more dramatically than a general, nice, uh, kind of balanced wavelength with the reds and all that. Now, that being said, there is no research right now in humans that blue light actually damages the retina, the back of your eye. So, these whole like scare tactics, like burning my eye. No, there's no evidence of that, especially with the strength of the blue light. Okay. Because we also have, light strength. Okay. The worst blue light is actually technically in the sun, but we like sun because it has the distribution with the other wavelengths. So there is no evidence of that. Does it actually disrupt the ocular surface? That's up for debate. Some people feel better when they block some of the blue light in general off their screens. They could be light sensitive. So that it does give calming effects to some. And absolutely, if you don't already know, the pineal gland in our brain is triggered by blue light to yes or no release melatonin, which we don't need to talk about melatonin. So blue light does help with pineal gland distribution of melatonin, which hence, goes back to the sleep conversation. But even that is up for debate if blue light glasses do anything to
Okay.
fully improve that. So right now for blue light and sleep, I usually say let's reduce it as much as possible, 2 to 4 hours prior to your sleep time. Obviously, everyone's on their phone right before bed. So if you had to choose a time to block blue light, use your night mode. Even there's now screens you could put on the actual device to reduce the
Okay.
blue light emission. Great. But it is not like yeah, blue light's great. Blue light blocking glasses are great. Just use them all. And that's why there's so much misinformation out there.
Okay. All right. I'm going to ask a question, a little off the cuff. I
Okay.
heard you say um, the water line in our eyes. I think you said this produces or they produce important oils, right?
Mhm,
We don't want to
mhm,
block those. So, makeup.
mhm.
You know how some eyeliner um, you can put on your waterline, and it just made me wonder if that is potentially going to clog up, those oil producing, what do we call them? Ducts or glands? I'm not sure what
Glands. The
okay,
technical term is meibomian glands. That's
okay,
their name, meibomians or MG and MGD's dystrophy. So the answer is absolutely yes.
okay. So
You know,
you're not advocating putting
we
eye makeup
don't
on the,
waterline, no.
okay,
And that mechanical pressure. Now, if you're doing it for, listen, I'm a
once in a
woman.
while.
I
Yeah.
I'm not like black and white. No, but if you need it, fine. But if you're doing it every day, if you're getting a tattoo, eyeliner, you are killing off your meibomian glands. Um,
Okay.
and over time, and that's just another
Interesting.
stimulus for dry eye disease because that is such an important gland for the oil of our tears, which reduces evaporation
Okay.
and layer that with hormone changes. That is where we super see big differences in the meibomian gland with hormone shifts, especially in females. So you kind of couple that together, and now you have miserable red, irritated eyes. Um,
Interesting.
Absolutely not recommended.
Okay. Oh, wow. So the eyeliner tattooing that can damage
Absolutely.
things.
Even there could be disruptors of basically the makeup itself, the chemicals of the eye makeup
Sure.
itself can disrupt various components of of your eyelids, which can impact dry eye.
Okay.
In fact, there's an awesome makeup company that is called Eyes Are the Story that she literally just looks at the research and the makeup is based on that fact of keeping those chemicals out and being
Okay.
proactive with the most, let's just say, ocular safe
Oh,
makeup.
so good.
And yeah, and especially now we see makeup being used on what? Our 10-year-olds.
I know, right? Oh my
Yeah.
goodness.
So we have to be
That is such
proactive.
a that's
Yeah.
such a great point. Okay, so we won't go into my misconceptions too much, but I let's just suffice it to say I wasn't aware. I'm always like, well, it's such a small surface area.
Yeah, there's these little glands there.
But yeah, but a lot of potential damage. That and what is the name of that company again?
Eyes are the story.
Eyes are the story. Okay.
Yeah.
So we'll
Phenomenal makeup brand. Yeah.
Okay, we'll link that for everybody. Okay, so you've developed a dry eye lifestyle expansion approach. Can you just speak to how this changes the way clinicians ideally go about
Mhm.
thinking about the management of dry eye disease moving forward?
Excellent. So again, we have a lot of the preliminary questionnaires that try to help the doctor diagnose the dry eye, perhaps tease out the different types of dry eye, but we
Mhm.
have nothing at the end of the appointment where the patient is still sitting in your chair and you want to perhaps ask more questions about their lifestyle and transition that to something that's actually actionable. So my dry eye lifestyle questionnaire is composed of six sections. One is the digital behavior and environment section. We have nutrition and hydration patterns, movement and sedentary patterns, which you'd be surprised how much that connects to dry eye too. Sleep and recovery, as we discussed, a very important node. Stress and autonomic load. Stress is actually another factor. And then the sixth node that I put as kind of like a maybe pile is the women's hormonal health. So knowing if the woman has gone through early menopause procedures or is currently perimenopause, discussing the medications and the changes of her recommendations, or if she hasn't even seen anyone and needs further support in that node, because we do see a huge connection there nowadays. Not to say that HRT technically cures dry eye, but there needs to be more investigation, especially in those females. So that's kind of the framework. Obviously, I won't go
Okay.
through every question of every part, but then after that is given to the patient, then the flags show up where what questions are the highlighted problem areas, and then we have something called the clinical use summary at the bottom of the questionnaire where where the domains are highlighted, the most important domains in that patient that need to be addressed. And then that addressing either goes to a specific referral center that you hopefully have some sort of relationship with, whether it's a sleep center locally, a nutritionist, or you can do things in-house if you have a nutritionist on staff or you have some sort of education there to help guide that patient to the next piece of their puzzle. And it's really to give that bridge of confident referrals so that you give that patient the opportunity to investigate their modifiable lifestyle choices a little bit more efficiently and with proper mitigation.
Love that. All right. As we start to wrap up, are there any final words of wisdom that you'd like to share with our audience today?
Well, knowing that your audience is made up of many different clinician and
Right.
healthcare practitioners, but knowing that you have a high percentage of nutritionists, I have
Mhm.
to say the ocular health is just in general is really, really connected to nutrition. And if you're in an area that's densely populated or you have a lot of eye care facilities close by, don't be afraid to reach out. And a lot of times, whether it's for diabetes, it's for macular degeneration. Of course, we talked about dry eye today. Um, these clinicians may not even know you exist, and this may be a way for you to connect to them and
Mhm.
to offer their patients a valuable, basically a valuable referral where you kind of connect nutrition and good health with their ocular condition. And that is something that I think is underutilized. If we had everyone on the Mediterranean diet, as I said, we'd fix a lot of things, but it's a simple statement. And I think the nutritionists out there have a very, very good opportunity here to help our eye care providers and ultimately our patients.
Okay. I love that. Yeah, I never hear about nutritionists approaching optometrists or, really any specialization in the eye care arena. So that's a great tip.
Yeah, and we have a lot of evidence, and it's not something that is that you have to dig for.
Yeah.
We there's sound evidence. It's coming out quicker than we can keep up with. As I said before, I always say it's the paper to the person. So we can have all these papers, we got to get it to the person.
And Dr. Neda, how can our audience learn more about your work?
I have a few connecting points. Obviously, LinkedIn is my professional. It's under
Okay.
my name, Neda Gioia. I have my clinical site, which is integrativevision.com, and that's where I see patients for comprehensive eye care. We're also launching a virtual version, not for the eye care piece, but for the ocular nutrition piece coming out
Okay.
probably in the next 2 months called See Health. And
Mm,
that's where I help connect that to a very curated number of patients that I can help. And my professional kind of guidance is Dr. Neda Gioia, DRNEDA Joya.com. And that's where I really just give some professional advice for expanding your clinic or connecting with other professionals, just
y-
things that I've learned over these past 20, 30 years.
you looked way too young, but anyway, you look fabulous.
It's the filters. I'm just kidding.
Whatever you're doing is working. You're
Thank
taking
you.
your own lifestyle advice, is my guess, and it is definitely working in your favor.
Thank you, Leslie.
So, yeah.
Same
All
to
right.
you.
Thank you. All right, everyone. So we're going to go ahead and wrap up. I will be sure to add those links so that you can learn more about Dr. Netta's work. And if you're at the upcoming IFM meeting, um, you're going to be presenting a poster. So you'll be on uh, the roster. Is that
Mhm.
correct? Okay.
Yep, yep. May
So
27th to May 30th,
great.
I believe is the range of time. Yep.
All
And I'll be
right.
there the whole time anyway. So if anybody sees
Fantastic.
me, send me a little
Yeah.
hello, and
Yeah.
I'm happy
Stop
to
by and say
connect.
hi. All
Yeah,
right. Sounds good. Thank you so much for your time today. And once you get that nutrition arm set up in your clinic, over the next couple of months, I'd love to reconnect with you on that and
absolutely.
learn more.
Thank you
All
so
right.
much, Leslie. You're doing a great job, and I appreciate you even highlighting this subject matter.
Fascinating topic.
Thank
And I
you.
know I learned a ton. So thank you for that. All right,
Thank you.
everybody. Have a great rest of your day, and I'll see you next time. Bye for now.